Good afternoon. I do want to start out, since I mentioned the last time I was here that Rupert, to my left here, is the closest I've been to anybody for a long period of time. You all should at least know that this is Rupert and this is Lori. And we very much appreciate your help and your support. So I want to start, first of all, by saying a few words about the heartbreaking news from the Holyoke Soldiers' Home. On Sunday night, Lieutenant Governor, Secretary Sudders, and I first learned of the tragic situation that was unfolding at the Holyoke Soldiers' Home. As of today, there are 13 confirmed deaths at the facility, with at least 6 attributed to COVID-19. As someone who has visited this amazing place on multiple occasions and found it to be a source of joy and grace and comfort and kindness for the residents, their families, and the staff that works there, this episode is a gut-wrenching loss that is nothing short of devastating to all of us. And our hearts go out to the families and the loved ones and the staff who have been so horribly impacted by this series of events. We have public health experts on the ground conducting a thorough review of the health status of all the residents and the staff there. And Secretary Sudders, Lieutenant Governor Polito, and I spoke to several members of the new team that's on the ground there this morning. And immediate steps have already been taken, such as implementing a clinical command team and testing all patients and staff at the facility. We're also deploying a wide variety of available resources to help them. This includes the National Guard, resources from the state's personal protective equipment supply, and medical professionals from other state facilities. Again, I want to extend, on behalf of all of us, our deepest sympathies to the members of the Holyoke Soldiers' Home community. They are many of our state's finest, all of whom served our country and all of whom sacrificed on our behalf. Let me just say this in advance. In the short term, our primary focus is going to be on stabilizing and supporting the health and safety of the residents and their families. And we will get to the bottom of what happened and when and by who. As we continue in this battle against COVID-19, we've had to take unprecedented measures in an effort to stop the spread of the virus. About a week ago, as many of you know, I issued an emergency order requiring the closure of all non-essential businesses that was in effect until Tuesday, April 7th. I also directed the Department of Public Health to issue a stay-at-home advisory for all residents of the Commonwealth. And this weekend, the federal government announced an extension to the White House coronavirus social distancing guidelines that would be in effect until April 30th, as they anticipate the peak surge of the virus to come nationally sometime in the next 2 weeks. They stated that by extending the distancing guidelines through April, their hope is to mitigate the spread of the virus and reduce the amount of people across the country that could potentially contract the disease. Here in Massachusetts, we've taken some of the earliest and most aggressive steps in the country to slow the spread of this virus, and we must continue to be aggressive in our pursuits. So today, I'm announcing an extension of the timeline for all non-essential businesses to keep their physical workplaces and facilities closed to all workers, customers, and the public until May 4th. This new designation on essential services will take effect tomorrow, April 1st at noon. This order also extends the 10-person limit on social gatherings until May 4th as well. With these extensions, We're issuing an updated list of businesses and organizations that provide essential services and workforces related to COVID-19 that will continue to operate during this time period. I'll get into more details on what this entails in just a minute. But I want everybody to know that we appreciate the huge impact on our economy and on our daily lives that these decisions have, and they have not been made lightly. But based on the facts on the ground, our Department of Public Health guidance to extend the stay-at-home advisory outlining self-isolation and social distancing protocols needs to remain in effect through May 4th as well. I know this is difficult to hear, but we need everyone to continue to go without being around many of your family and most of your friends for your own health and safety and for the health and safety of your family, your friends, and others. As most of you know, my weekly visits with my 91-year-old father are phone calls. And as I said previously, neither one of us are very good at that. And I miss him. But that's just the way it is. And it's the way it should be. And it's the way all of us need to be as purposeful as we can be in dealing with the contagious nature of this virus. For state government workers, we're also issuing an extension of the guidance to the executive branch employees regarding working from home that we put in place previously, and that will also be extended until May 4th. And as we get ready to face what we're predicting to be the surge here in Massachusetts, these actions will improve our ability to mitigate the spread of COVID-19 and the impact the surge has on our healthcare system. Now, we know that for many businesses and individuals, the measures that have been put in place have come at a very high cost. This includes the many local and homegrown small businesses in Massachusetts that we are so proud of. For them and for many others, it has not been an easy time, and we respect that. And we know that today's news won't make it any easier. But I know I speak for me and the Lieutenant Governor when I say that we've had many conversations with businesses across the Commonwealth that were deemed non-essential. And as concerning as that is to them with respect to the ongoing nature and potentially the future of their operations, they understand why we're doing it and why it's an important step to ensure the health and safety of them and their employees and others here in the Commonwealth. Because if we can limit face-to-face, person-to-person contact now, we can slow the spread and get back to work as soon and as safely as we possibly can. Last week, as most people know, we posted a specific list of business categories that we considered to be essential to supporting the Commonwealth through this emergency, which was based on guidance we got from the federal government. As a result, we've updated the categories, and some of these changes include clarity around the supply chain that supports other essential services, adding healthcare providers like optometrists and chiropractors, expanding the types of workers providing disinfectant and sanitation services. Based on the new guidance, we directed the Department of Public Health to issue an order with more specifics for hotels, motels, and short-term rentals like Airbnb. They are to be used for limited purposes only, which include direct efforts related to the fight against COVID-19. For example, as housing for frontline healthcare workers or for Massachusetts residents who have been otherwise displaced from their homes, or to house workers who are part of our essential business community. The point here is to reserve these spaces for people who need them as a result of circumstances that relate to or were caused by COVID-19 or other emergencies. Hotels and short-term rentals like Airbnb may no longer be booked for vacation or leisure purposes. People should really be using common sense on this one and should not be going on vacation right now. as we've said in our advisory, and as many other public officials at the state, federal, and local level have said, people should be staying at home. And as we've stated before, essential businesses need to and will continue to operate. Restaurants and other businesses that sell food may continue to offer food for takeout and delivery if they follow the social distancing measures that we've put in place. Now, we're extremely grateful for the many grocery store workers, gas station attendants, farmers, wholesalers, local, state, and federal government employees, and the many others who have continued to go to work and provide these necessary and essential services to the residents of the Commonwealth. And this updated list will be published later today at www.mass.gov/COVID-19. And while for the most part our dialogue and our conversation with the business community has been very productive and in some ways supportive of many of the initiatives that we've pursued with respect to defining essential workers and businesses, there is certainly confusion out there. But as we all know, this is an unprecedented situation. And employers with questions should review the COVID-19 Essential Services Frequently Asked Questions, FAQs, created by the Executive Office of Housing and Economic Development, which we will update to reflect the revised list of essential services we're talking about today. And there is a way for businesses to contact and engage with economic development on their website. And over the course of the past several weeks, there have been literally thousands of back and forths between our team and folks in the business community about clarification and engagement. But we would urge people to begin by reading through all the information first before they reach out. I'd also like to take a minute to once again thank everyone, especially those at home, for their diligence in adhering to the stay-at-home advisory that we put in place last week. People, for the most part, are doing the right thing, and they're not going to work and they're not going to school. People are pushing off life events like weddings and family reunions, and hardest of all, people are missing out on important time spent with loved ones. We know we've asked a lot of people, but there is more that must be done. Everyone should continue to avoid unnecessary close contact with others, and when you go to the grocery store or the pharmacy, stay 6 feet away from the person nearest you. Go outside, go for a walk, go to the park, but don't do it in big groups. Don't play basketball just because you can, or sit on the beach all day with your friends. We cannot have big groups at our parks. We're considering taking some steps to deal with this, but everyone else needs to do their part too. Please continue to do what you can to avoid big groups. We know this is difficult, but these next few weeks will be critical to mitigating the spread of the disease and ensuring that our healthcare system is prepared for what is yet to come. As I mentioned earlier, we're also extending the guidance that we issued to executive branch employees to make sure we're keeping state government running and providing key services to those who need it, while still protecting the health and safety of our workforce and the public. All employees performing what we've called non-core functions who are able to work remotely should continue to do so until May 4th. This end date matches up with our decision to extend school and non-emergency child care programs through May 4th. The closure of school and non-emergency child care programs through May 4th. Executive branch employees that have been required to report to work and need alternative child care arrangements are encouraged to review the list of exempt emergency child care providers. I would also want to mention and remind folks that many of the services offered by the Commonwealth that are public or customer-facing are still being provided in person, but people should use online tools if they can, and many of the other ones are available by appointment only. Yesterday, we talked about some of the ways our COVID-19 Response Command Center is working to establish expansions to the state's existing hospital capacity. The Command Center has begun working with long-term care facilities to establish dedicated skilled nursing facilities to care for individuals infected with COVID-19. This initiative offers an alternative location where individuals who are stable but still need medical care can be transferred to recover, relieving pressure on hospitals. As we planned for the surge, we requested and received approval for a field medical station through MEMA that will provide additional medical care capacity. This type of facility is intended to lower acuity care needs that increases local healthcare capacity during large-scale emergencies. The Commonwealth has requested 3 of these stations. This week, we received approval from the federal government to deploy a 250-bed facility at the DCU Center in Worcester. It will be used to treat lower acuity patients who still need monitoring. The facility will be stood up starting tomorrow when 3 tractor trailers will arrive in Worcester with the necessary gear and equipment. Just want to say how grateful we are to UMass Memorial and the City of Worcester for stepping up to partner and staff this facility for the Commonwealth. UMass Memorial will lead the day-to-day running of the facility once it's up, with support from state and local partners. This facility is another important building block in our efforts to expand existing healthcare capacity, and we are actively identifying other sites and partners for 2 other facility locations. Let me just close by saying this. The next couple of weeks are going to be critical in this battle. Everyone needs to play their part. People need to stay home as much as possible. Follow the essential business orders we've put in place. Use good personal hygiene, and follow the social distancing guidelines to prevent the spread, because it will make a huge difference in this fight to everyone here in the Commonwealth. At the same time, we understand just how much we've been asking of all of you. We've asked you to stay home, to not go to work, to not go to school, to skip weddings, to skip funerals, to skip going to the houses of worship that for many people are critical to their spiritual development. We've asked you to miss out on important, precious time spent with family and friends. We know we are asking a lot. But I want to conclude the same way I started, by pointing out how important it is, how purposeful it is, that we all take seriously these issues associated with distance. It is in many respects our single biggest weapon in battling COVID-19. On behalf of the Lieutenant Governor, myself, Secretary Sudders, and the rest of us who are working this issue every day, I want to say thank you. I want to say thank you to the nurses and doctors and frontline medical workers and first responders for all that they do. I want to say thank you to our National Guard for getting out there every single day and providing support to our men and women in public safety and fire and EMS. And to the public sector workers at the state, federal, and local level, I want to thank you all for showing up and serving. And to all those essential workers who work with essential businesses that do very important things to keep people in Massachusetts healthy and safe, God bless and thank you for all you do as well. The state is filled with remarkable people and remarkable communities. And time and again, we have watched them rise together to fight, to battle, and to win. And we are about to enter what will be perhaps the most difficult period associated with this particular virus. And there's no doubt in my mind, the Lieutenant Governor's mind, or anybody else's around here, that you will all perform above and beyond. Thank you. With that, I'll turn it over to Secretary Sudders.
Thank you, Governor, Lieutenant Governor. Good afternoon. Starting late Sunday night and through Monday, a series of actions were taken to ensure a safe environment for our residents at Holyoke Soldiers Home and for the staff. As you know, we quickly asked Val Liptak, who is a nurse and who has served with distinction as the Chief Executive Officer of Western Mass Hospital, to assume immediate responsibility for the administration of the Holyoke Soldiers Home. We also immediately put together a clinical command team who was on site and has been on site since Monday morning and is responsible for comprehensive and rapid response to the outbreak of COVID-19. Also on site today is the National Guard, and General Keefe is actually there. The command center, the command team includes, as I said, Val Liptak, just for people who do not know her. She is a registered nurse and a healthcare executive, where she served with a distinction for 6 years at Western Mass Hospital, and she previously served as the COO there for 6 years. She's been a supervisor of long-term care facilities, a hospice nurse, and an RN in an ICU. Joining her is Lisa Colombo, who's a doctor in nursing, and is the Executive Vice Chancellor of the Commonwealth Medicine, and she's previously been the Director of Inpatient Nursing at New England Baptist and was the Chief Nursing Officer of Leahy Hospital. Joining them includes Cheryl Poppy, who's the current Superintendent of the Chelsea Soldiers Home and was for 4 months, in fact, the Acting Superintendent of Holyoke Soldiers Home. Along with Mohammed Dar, who is the Mass Health Medical Director, and he practiced internal medicine at the VA hospitals in Brockton and West Roxbury. 2 nurses, one of whom was a FEMA incident commander and is a former U.S. Army medic, Mark Segru, and also joining is the new Director of Nursing at the Holyoke Soldiers Home, Vanessa Lossier. We continue to add staff to the team. Our priority is to ensure that the home is stabilized. As the governor said, as of today, there are 13 deaths, and as you heard, 6 are COVID positive, 5 pending, 1 negative, and 1 not yet known. 100% of this facility veterans and staff are being tested for COVID-19. We rolled out what I was going to announce, which I will talk about, which is our mobile testing team for nursing homes. We started it today in Holyoke. We've created a family hotline at 413-552-4764. It's a dedicated line for family members to check in on their family members, and it is staffed by social workers. It is available Monday through Saturdays. And we're obviously working with the unions and the staff to ensure everyone is safe. Today, we rolled out, we've been planning to do this at the end of last week. We've been sort of finalizing. We understand how difficult the social distancing and restrictions that have been in place for nursing homes, assisted living residences, and other senior housing facilities. We are asking for the public and families who are understandably concerned about their loved ones to please redouble their efforts to maintain vigilance to social distancing and the visitation restrictions. Reach out regularly by phone or other communication means, but please do not visit. Managers of these type of senior housing facilities are doing everything we're asking of them to keep our older residents safe, but they need the continued help from the public and families to ensure that spread of the virus in their facilities is prevented or mitigated. As you know, we continue to expand testing capacity so Massachusetts can continue to isolate positive cases and prevent further spread. Nursing home residents are among the most vulnerable, and we need to provide expedited testing and treatment to identify and to appropriately care for them. Today, we implemented a pilot project that allows for safe on-site testing of residents of nursing and rest homes with a quick turnaround. The pilot is operated under the auspices of the Massachusetts National Guard in partnership with the Department of Public Health and the Broad Institute of Cambridge. The pilot allows for safe on-site sample collection by trained personnel from the Massachusetts National Guard. The program tests symptomatic nursing and rest home residents in the rest homes or wherever they're living with a quick turnaround. We recognize that our elder populations, especially living in high-density environments such as these facilities, are some of the most vulnerable. The National Guard is mobilized to operationalize. In fact, they're operationalized today, and we will have 7 mobile teams around the state. We expect to have 7 teams in response to needs of nursing homes. The samples collected from residents will be transported directly to our state public health lab and prioritized for testing by the Broad Institute. We expect them to be turned around in 24 to 48 hours. Prior to the launch, the only way for nursing home residents to actually be tested was to go to a hospital or to a physician's office. Governor.
Questions?
Governor, on May 4th, extension
So two things. One is the order's not exactly like the order in Vermont, but it's a lot like the order in Vermont. And the platforms, like Airbnb, actually put out guidance to their customers and to their operators saying, these are the terms, these are the conditions associated with the order that was put in place in Vermont. We expect them to do the same thing here in Massachusetts. And local officials will have the ability to basically shut these down if they find them. And I fully expect there will be places where this will be a big deal. The biggest one I can think of right off the top of my head is the Cape. And certainly Berkshire County, too.
How about the non-essential businesses? Have you run into any problems with businesses opening up? Have you had to use any enforcement so far?
There have been some. Yeah, there have been some. But most of that has been done at the local level. And I'm looking at the Lieutenant Governor. She gets these calls as often as I do. I don't remember a local government that wanted to shut down a non-essential business that had trouble doing so. Yeah, for the most part, if the locals say you're not an essential business, it's pretty hard for them to stay open if we don't believe they are and they're not on our list.
Governor, you've been ramping up some of the restrictions and the advisory. May 4th, do you think, from what England Secretary Sudders knows, what will happen after the surge passes through Massachusetts? Will we start to see, what will that look like, giving hope to businesses who say, I can do it on 2 weeks?
Yeah. I get a little nervous about speculating too much about this because, again, it's never happened before, so it's a tough thing to draw a lot of experiential conclusions about. I think what I can say is that much of the work that we've done over the course of the past several weeks in terms of the shutdowns and the economic impact of that and the work that's being done by the command center to build out additional capacity has all been about sort of reducing the size of the surge and spreading it out over a longer period of time. And if you look at a lot of the data that people had for Massachusetts 3 weeks ago and the data they have now, it has moved. The surge has moved back with respect to where people thought it was going to be. And we're currently in the process of dealing with gear, beds, personnel, and what I would describe as sort of geographic recognition of where we anticipate and expect we're going to need to put a lot of that stuff to ensure that we have the resources in place to serve the need. I'm not really going to speculate on what happens after that because it's very hard to tell, first of all, how long it might be, and secondly, I am expecting that we will get a lot of guidance from public health experts and others based on what actually happens and what the facts look like with respect to what happens next. There have already been, I've read 3 papers that have been published on sort of life after the surge, and they have some commonality to them, but they have some differences in them. And I think the best I would say at this point is our view is let's do all the things we possibly can to get through the surge now, and then we'll deal with what comes through on the other side. I mean, we're having constant conversations with folks in the business community, gathering ideas, collecting information, but I don't think we should be speculating about this until we get to the other side.
Governor, did the superintendent at the Holyoke Children's Home conceal these deaths as the mayor of Holyoke believes?
What I can tell you right now is that the conversation that the Lieutenant Governor, the Secretary, and I had with the mayor on Sunday night was the first time we were made aware of this. And we do not want to, and we will deal with that, okay? But in the short term, our goal was to put as many, as the Secretary said, our goal in the short term was to put as many qualified resources at Holyoke Soldiers Home as we possibly could, and to start doing the work of dealing with the health and safety issues of both the residents and the staff. I want to go back to something I said before about the Holyoke Soldiers Home. I mean, it is a really special place. And for those of you who've never been there, and this is the first time you've ever heard anything about it, I can't tell you how different this story is than the reality of what that place has been like day for day, day after day, for literally decades. It is a happy, joyous, fun, graceful, and kind place filled with those kinds of people. And when you go there and you spend time with the residents and their family members who are visiting, the thing you hear over and over again from the family members is, I wouldn't want my family member any place else other than here. This is the best place we ever could have possibly dreamed of putting them. Now, we will figure out what happened, okay? And we will deal with that. But in the meantime, our early goal is to make sure we deal with all the issues associated with the health and safety of these patients, these residents, and the staff, because they are in many ways our first priority at this point.
Are you looking at Chelsea to make sure that nothing has happened in Holyoke, no situation?
I'll let you speak to that.
So on Sunday night when I called Cheryl Poppy, who's the superintendent of the Chelsea Soldiers Home, and asked if she could go out to Holyoke, because she knows the facility well and had served, as I said, acting superintendent for 4 months. I wanted to ensure that in doing that did not obviously then destabilize, if you would, Chelsea. She has a very strong management team. She has a very strong second deputy. And so she felt quite comfortable in going to Holyoke for a couple of days, like boots on the ground, to help us stabilize the place. So as the governor said, we are, this unrolled to us late Sunday night and immediately went into action of stabilizing and putting different administration in place for Monday. And so I can't actually answer the detail of your question. That is one of the things that we need to understand is when the individuals died, when were they tested, who was notified in their family, and that is, as the governor said, that's part of what we need to really understand. Also in terms of just notification up the chain, if you would. There's a critical incident reporting process in Health and Human Services, and these were not reported up through that.
Secretary, are there any confirmed cases in Chelsea?
Yes, I believe there have been 2, but let me also confirm back with you, Matt, how many confirmed cases there were. There were, I think, confirmed no deaths.
So when you talk about the situation in the prison and jail system, there was a hearing today before the SJC, an effort to release inmates to protect them from COVID. My understanding is you have executive powers in an emergency situation to either countermand or overrule a judicial decision. What's your understanding of the situation and your potential powers and how you might use them?
Well, first of all, I'm not privy to what actually happened in court today. What I can tell you is that we, on the DOC side, the Department of Corrections side, we had an incident at Bridgewater State Hospital. There's some debate about whether people were completely upfront with respect to their physical status. And as a result, we have a number of cases there, and they have been isolated in the facility. We do not have, at this point in time, any cases inside the rest of the DOC system. We have several guards, correctional officers, who tested positive, and they are isolated and quarantining at home. But we've had conversations with the folks in the county correctional system about this, and I think we all feel that this is not, unless there are very particular instances where a medical parole that actually can go someplace that makes sense, or a parole that actually has lined up a place to go in the community with support services, this is a very difficult time to be putting people into the community unless you really believe that's going to be better for them and better for the community. And I think our view is we don't buy, as a matter of law, fact, or policy, that the argument that's being made before the court is the correct one. We believe the correct position is for us to continue to do the things we're doing to keep people inside the system safe, and that's going to be the way we play this one. I mean, if the courts make a ruling that's different, we're obviously going to read it and incorporate it into the way we make decisions. But we do not believe that the advocate representation of either the facts or the policies or what's best for the inmates or for the communities is the right one. Pardon me? I believe the way this worked was there was a special master who wrote up an agreement, a potential settlement agreement, which basically was rejected by both sides, which is why there's a hearing in front of the court now.
This letter from the Mass Nurses Association, which is critical to state guidance on PPEs, they seem to think it's giving a hint to the medical facilities that they can ration masks. And the nurses say, look, every time we go into a room, no matter whether we think the person is positive or not, we should be protected. How do you feel about that letter?
Well, we've said several things about this issue. The first is to bang a drum that I bang every time I'm here. Telehealth is a covered benefit in Massachusetts. People should be using it. It's the best and easiest and most effective way to keep somebody who believes they're symptomatic and a clinician separated from each other, but able to engage in a covered benefit conversation and discussion to determine what should happen next. So point number one, it's a covered benefit, telehealth, you should use it. If you are symptomatic, call your clinician and engage them in a conversation, video chat, that stuff is covered. You can also, if you're symptomatic, go to buoy.com, which is an available self-diagnostic tool on the web that has millions and millions and millions of data points that have been collected over the course of the past 5 years to get guidance. And if the guidance is you should talk to a provider using telehealth, that system can send you directly to a provider to have that conversation. So point number one is the things we can do to try and encourage people to engage in a conversation about their health and their health status without necessarily putting them face to face are the right things to do. The second thing I'd say with respect to the guidance is that guidance is pretty consistent with the guidance that's been issued by a lot of other states and by a lot of other public health authorities. The third thing I would say is we are continuing to chase PPE, personal protective equipment, for first responders, healthcare providers, nurses, doctors, the works, and I'm hoping we're going to have more positive information to share on that later this week, because we do agree they need more gear. We've said that for 2 weeks, and have engaged in a lot of really interesting conversations with our colleagues at the federal level about that. Pardon me? We're waiting for the legislature to act on that one, yeah. Look, we both tend to be optimists about this sort of thing. We've had several conversations with the leadership. They know this is an issue. They know it's a problem. They know it needs to get fixed. The clock's ticking, obviously. I think, you know, I haven't talked to Commissioner Riley or Secretary Pizer about this in the last couple days. I'm looking at you. Have you? Yeah. We should probably engage them in a conversation. We would like to be able to have the legislature make this possible for communities to put this off to a new date, which we filed. We also would like to see the flexibility with respect to the MCAS test get put in place. Those are things we've gotten a commitment from the legislature to act on. We would like to see that happen for all the reasons that you raise. It creates uncertainty and confusion, and we get that. You know, I think DESE has the ability to sort of provide some cushion on this. Okay, if the law was in effect and a school district said to us, if things were sort of business as usual, and a district said to us, you know, we need 10 days, DESE would say fine. Okay, so I think the game plan here is to hope that sometime in the not too distant future the legislature can get us a bill that solves this problem without putting districts and the administration in a bad place with respect to something everybody agrees is really important, especially for the districts that are required to file those district improvement plans.
Restrictions for state forests, parks, state-owned property,
Yeah.
whether it's
So this is the source of constant conversation between the Lieutenant Governor, local officials, myself, Secretary Theoharides, the folks at the command center. You know, what's the right amount of effort and the right amount of guidance that's associated with some of these issues? And what I would say to you is we believe, based on the conversations we have and what we see ourselves, that most people are taking these issues with respect to distancing and staying at home and recognizing and understanding the importance of reducing, if not eliminating, person-to-person contact pretty seriously. But when we see things that trouble us, we will do something about it. And I'll give you a good example of that. The decision we made to close down the bars and the restaurants came after a lot of the behavior we saw the weekend before St. Patrick's Day. It was very clear at that point that there were a lot of people who weren't paying attention to the guidance that we had put out at that point in time. With respect to the parks and some of these other issues, every tool in the toolbox is there. We'll use them if we need them. We try to make those decisions based on what we actually see happening.
Give us an update on unemployment. I know yesterday you said you're waiting for the feds to send us some insurance, but people are saying they're having problems signing up online. Is there anything to expand it?
Well, keep in mind that when 2 weeks ago, we had a 50-person call center working in the the Division of Unemployment Assistance, an established call center in the Hurley building. We now have like a 500-person remote call center. I mean, they've scaled up literally by a factor of practically 10 to enhance their ability to both take incoming calls and to call people back who call in with questions. And I've said a couple things here before that I think are worth repeating. One of them is when someone fills out that application, if someone's part of the unemployment system, if they're not a contract employee, if they're not self-employed, if they work for an employer that actually contributes to the unemployment system. Remember, this is the way the unemployment insurance system works is, for the most part, the people who qualify are the people who pay in. And the people who pay in are people who work for businesses or have their own business where they actually contribute to the system. If you're in that system, if your employer, if you as an employee or an employer is in that system, you need to put the name of your business or the business you work for exactly as it appears on your W-2 onto the application. If you don't get that right, the application will kick. And that's one of the main issues associated with applications that don't pass the first time. If your application passes the first time, your social security number checks, your address checks, your phone, all that stuff checks, you typically get paid in 7 to 10 days, the first time you get paid. But they are working to process a lot of the stuff that's come through that's kicked out and are constantly working down through those people who have submitted, but for whatever reason their application didn't process the first time. With respect to the people who aren't in the unemployment system, a community that we spoke to our colleagues at the federal level about said it's important we do something to make sure that the folks who aren't in the unemployment system have some access to something. We basically support what the federal government is seeking to do here, which is to create a benefit that's never been done before for people who aren't in the unemployment system. The only information we have on these people, for the most part, is if they file taxes in Massachusetts. So question number one to the feds, and this is not just us, this is every state, how do you want to frame how you count what these people make and what they should receive through a secondary unemployment system, insurance system, recognizing that you don't currently have, except their tax return, any data in your system about what that should be. You know, should it be 70% of what they filed on their W-2 or on their state tax form? I mean, what's going to be the mechanism for determining what those individuals should be paid? And once we get that guidance from the federal government about how they want us to structure that, we'll do everything we can to set the thing up and move it as quickly as we can, because we know how important this is to people. And I want to repeat, I'm glad the federal government recognized that there's a community out there that works hard and has always worked hard, and for the most part, through no fault of their own, can't go to work right now, but they're not in the UI system. And the feds need to give us guidance on how they want us to spend their money, the federal money, on standing something up for these folks.
If you reclassify adult use cannabis,
I've said before, and the Lieutenant Governor and I and Secretary Sudders and others have talked about this, we are doing a lot of things to try to get people to stay at home. We put out a travel advisory that we hand out at the airport and in other places that says, if you're not from Massachusetts, we expect you to self-quarantine for 14 days if you come here. There is tons of evidence that because Massachusetts is one of the few states in the Northeast that's legalized recreational marijuana, that if we make recreational marijuana available as an essential business, remember, medical marijuana is available as an essential business. If we make recreational marijuana available, we are going to have to deal with the fact that people are going to come here from all over the place, across the Northeast, and create issues for us with respect to the fundamental issue we are trying to solve for here, which is to stop the spread. And for that reason and that reason alone, I think this is just, it's a non-starter with us.
but if you're limited to just Massachusetts residents only,
I don't know if that's I don't know if you can do that legally. It's certainly something that some folks have talked about.
Last question here, last one. The state has not identified nursing homes where there have been positive cases or outbreaks. Why not make those public if they can help us better inform the public, especially those who may have loved ones in nursing homes?
Do you want to answer that one? There have been public, I've read many stories about places where there have been public notification with respect to cases in both senior living facilities and in nursing homes. Many. In fact, Hunt is, if I sat here for a minute, I could run off 8 or 10.
Those facilities themselves have done it, which makes it obviously very piecemeal, is my understanding. Why not the state?
Yeah, okay.
Take that step.
So I have directed the Department of Public Health to figure out what they need to do in order to put that data forward. Just like it took us a little bit of time to start putting out age categories, this is sort of like the next iteration of what we need to do to put out more transparent data to the public.
So taking a step.
Yes, absolutely.
Thanks, everybody.
Thanks, everybody.